Hi everyone, this is Dan with ThoroughCare. I recently did a webinar talking about the upcoming changes to the 2024 physician fee schedule. One of the biggest changes of the entire year is the changes for rural health clinics and FQHCs, particularly around G0511. Medicare made some great changes that we think RHCs and FQHCs will really like, and I hope you watch this video to learn about these changes for your clinic. Let's talk about the changes to the rates and reimbursements. Your rate for 2024 is $71.68. So again, it's down slightly, but we've seen worse in previous years. So down a few bucks, but the changes that we're going to talk about in a second will make up for this, I promise. So bear with me. But this is your rate for 2024. All right, general care management. This is one program that I think does get better over time. When I'm asked to explain general care management, sometimes it's hard to explain because everyone knows about chronic care management. They have their own codes. And what CMS did for general care management, I like to explain it like a big cooking pot. So let's say you're making soup. CMS put all of these things in this one pot. So some of these CPT codes or CCM, PCM is in there, chronic pain management is in there. So there are all these different things that you could do under a very general code. And it's interesting that CMS did it this way, but they did. And so you could do any of these services for your patients and bill G0511. And each of the programs has some requirements that you have to adhere to. For example, you have to have a certain number of minutes. So the CCM codes all have different minutes. The problem, though, up until this point, is that you could only do this code once. It had a limit of one instance per patient per month. And the cap was at 20 minutes. So you might be looking at this and say, well, CCM is in there, behavioral health's in there, complex is in there, chronic pain. The problem is that no one wanted to do all these programs because you weren't incentivized to. And I think CMS started to realize that when they issued feedback, when they issued the proposals back in July, this is really one of the first times where they specifically asked about feedbacks for the payment model for G0511. And they always encourage feedback, but they specifically asked for it around how can payment for G0511 be improved. What did they do? I think you're going to like it. It's very interesting what they did. So going back to my soup pot example, what they did is they put a lot more things in the pot. They put RPM in the pot, remote patient monitoring. They put remote therapeutic monitoring in there. And community health integration, principal illness navigation, they are in the pot too. So very interesting that they just made this program, G0511, a general program, much more comprehensive. The best part though, and if we're sticking with my example, it's now all you can eat. You can go back for multiple servings. So you can now do 20 minutes of RPM, 20 minutes of behavioral health, 20 minutes of CCM. So all of these codes are in the mix, and they are particularly in the mix because CMS called them out specifically. And the averages of all these codes is what makes up your average reimbursement, the one we talked about earlier. So this is definitely a good thing. In our opinion, we're very excited about it. Not so much as the additional codes, although that's great, but not being capped at 20 minutes is the biggest change that we're excited for. So let me give you some examples. Here's the rule, and I'm going back to my disclaimer. You can consider this a gray area. G0511 can be billed multiple times in the same month for different care management services if the resource costs associated with each of the services are separately accounted for. So that's the key line, different care management services. So if I go back to my pot, if I meet the qualifications for different services, I can bill multiple instances of G0511. I will note that as of today, the final rule does not appear to establish a maximum number of times that G0511 can be billed in a given month. I think 2 times and 3 times will probably be common. If you had more than that, we don't see anything in the rules that says it's limited. I will tell you, if you are going to bill more than that, make sure you have a heck of a good documentation trail. And that's our rule all the time, to make sure anything you bill, you can justify the time that you spent. But you aren't allowed to log your time, double dip. You can't, if you're spending 10 minutes on the phone, you can't say, well, that's 10 minutes for CCM and 10 minutes for BHI and 10 minutes for RPM. It really has to be separate if you're going to bill for it. So let me give you an example. And I mentioned RPM is now in the pot. That's a great opportunity for you. I will say, though, that your counterparts on the fee-for-service side have a reimbursement for the device itself if the device is used 16 readings per month. You guys do not have that. So G0511 is still a minutes-based code. So it's a little interesting that CMS would put the device code in the pot, but our interpretation of it is that if you get 16 readings per month, you can't just bill another instance of G0511. However, if you get 20 minutes of CCM, you can bill for the 20. And when I say you could bill for it, you're always billing for G0511. You're never using any of these CPT codes, but the CPT codes are components of G0511. So 20 minutes of CCM, 20 minutes of RPM, we're very confident that you could bill for 2 instances of G0511. Now, I mentioned CHI, PIN, RTM are all in the pot. However, I don't think it's a good use of your time just yet, because CHI and PIN are 60-minute programs, and RTM is restricted to just 2 conditions, respiratory and musculoskeletal. So the fact that CCM is in the mix, that creates an opportunity for you guys to do general care management. So in CCM, and this is going to kind of tie into my recommendation, out of everything in the pot, the best ingredients are the CCM codes. Here's why. The time requirement to complete this one is 20 minutes. The time requirement to complete the additional 20 minutes is obviously 20 minutes, and you can bill that multiple times. So you could get reimbursed at 20, at 40, at 60, at 90. As long as you could justify that it meets the requirements of chronic care management. The fact that CMS put the additional 20-minute code in the mix gives us reason to believe that you can bill if you get 40 minutes of CCM. Back to my disclaimer, this is totally unclear, and we expect CMS to confirm it at some point, but just keep an eye out on it. We can't think of a good reason that they would list it as a program in the mix if they wouldn't allow you to bill those 20 minutes. But again, I am not a legal and healthcare law expert. But again, every time a new program comes out, there's a lot of interpretation, and then eventually things get clarified. It happened a lot with RPM and RTM. But the reason I think that the CCM programs are a good opportunity for everyone is that most of your patients probably have 2 chronic conditions, and the time requirements are the lowest that you need. So you could do CHI and PIN, but they require 60 minutes. And even if you do PCM, principal care management, the time requirement on that one is 30 minutes. So if you have one patient that has one serious condition, you could absolutely do 30 minutes of PCM as one instance of G0511, and then maybe you gave them a blood pressure monitor and you can bill another instance of G0511 for RPM. But again, when you, on your billing claim, the only code you're going to have to use is G0511. We do not see any requirements that you have to list that says, well, this is the program that I completed. We do always suggest that you have documentation to back up how you got the time and what you what made up those requirements. So if you use ThoroughCare, for those of you who are ThoroughCare clients, our time logging will have you covered in this case. But Everyone should make sure that you have the reports to back it up. So I do think that G0511, because CMS called it general care management, I think that completing the 4 basic CCM codes are probably your best path forward. But again, you have a lot of programs you could do. You could do behavioral health now. But the big thing is you don't have to stop at 20. And that is the best change, in my opinion, of the entire year, is that you can get paid for doing those additional things. So in January, you could get paid extra for multiple instances of G0511. But be careful that some of the programs, if you say, hey, I do want to do PCM, well, PCM has a 30-minute time requirement. So just keep that in mind. And that's why I say that the quickest path is CCM, because the codes are 20, 20, 60, 90. And I could make the case that if I were managing a patient with diabetes and hypertension, and I gave them a blood pressure monitor, that monitoring that number, talking to the patient, creating a care plan for that hypertension management fits under CCM as well. I don't know that I necessarily need to bill RPM just because I gave the patient a blood pressure monitor. I wrote an article in the NARHC newsletter last year that anyone can do RPM. The problem is you just didn't get paid extra to do it. So any clinic could have, all these last couple of years, you could have given your patient a blood pressure monitor. But the fact that they were likely in CCM and you wouldn't get paid extra and you had to buy the device up front, it just never made financial sense. So this is the first year that it makes financial sense. So like I said, our favorite ingredients in the pot, staying with that example, the CCM programs, the fact that CMS purposely listed all of these 4 codes in the mix. They didn't have to do that. And so our interpretation is, if they didn't want you to bill this 20 extra minutes, why would they possibly list 99439 in the mix? Again, new program, it could always change, but this is the way we're interpreting it for 2024. If you'd like more information about the 2024 physician fee schedule, please see the links below. If you found this video to be helpful, please like it below and subscribe to our channel so that you get all of our updates. Thanks for watching. Goodbye.